Hi guys and welcome to our module on the muscles of the lower limb. So in this module we're talking about the different muscles at different regions of the lower limb. We start with talking about muscles of the hip, then we move on talking about muscles of the thigh, then we'll focus on the muscles of the leg, and then we'll round up the particular module by talking about muscles of the foot. The hip is made up of two major regions. This includes the pelvis and the gluteal region. And as a result, we have muscles that tend to span those two major regions. So the muscles of the hip are grouped into two: the muscles of the pelvic region, muscles of the gluteal region. In terms of the muscles of the pelvic region, we have two major muscles there to note. This includes the iliacus muscle and the pectineus muscle. These muscles are highlighted in the image below. You can see the iliacus muscle here in green. The iliacus tend to unite together with another muscle coming from the abdomen known as the psoas muscle, and both of them would give rise to what we call the iliopsoas muscle. Then we have the pectineus muscle also shown here. This is pectineus present here in brown. So both the iliacus and the pectineus tend to be found largely in the pelvic region of the hip. In terms of the origin and insertion, the iliacus muscle tends to originate from the superior to third of the iliac fossa. As you can see, it's sitting directly on the iliac fossa, and then it inserts on the lesser trochanter of the femur. Remember that it combines with the psoas muscle. So both of them, both the psoas muscle and the iliacus muscle, will combine into a single tendon, and that tendon would insert at the lesser trochanter of the femur, somewhere around this point. In terms of the origin and insertion of the pectineus muscle begins from the superior remorse of the pubis. That is shown here. So it begins at the superior remorse of the pubic bone, and it inserts at a part of the femur known as the pectineal line of the femur, not shown in the image here, but it inserts directly on the femur on an elevation or a landmark known as the pectineal line. Both of those muscles, both the iliacus and the pectineus muscle, are supplied by the femoral nerve. The iliacus muscle is present there for the function of flexion of the hip joints, while the pectineus muscle is present for the purpose of flexion and adduction of the thigh, and it also assists in medial rotation. Moving on to the gluteal region, the muscles of the gluteal region are sub-classified into two major groups. We have superficial groups of muscles that are found more towards the surface, and then we have the deep group of muscles that are buried underneath the superficial group. Let's talk about the superficial groups of muscles in the gluteal region. We have four major groups of muscles in the superficial aspect of the gluteal region. This includes the gluteus maximus muscle, the gluteus medius, the gluteus minimus, and the tensor fasciae lata. Three of them are shown in the image here. The gluteus maximus tends to be the most superficial, followed by the gluteus medius, followed by the gluteus minimus. The gluteus maximus, in terms of its origin, originates from three major points. It originates from landmarks found in the on the posterior part of the ilium known as gluteal line. So we have three major gluteal lines to note, and each of these gluteal lines will serve as origin point for most of the muscles in the gluteal region. So this includes the posterior gluteal line with superiority, then an anterior gluteal line, then an inferior gluteal line. So we have posterior gluteal line here, anterior gluteal line here, and inferior gluteal line. In terms of the gluteus maximus, it originates from the posterior gluteal line, but it also extends medially to also have a bit of origination from the sacrum, the dorsal part of the sacrum and the coccyx, and from the sacrotuberous ligament. So the gluteus maximus has three origin points: the posterior gluteal line, the dorsal surface of the sacrum and the coccyx, and the sacrotuberous ligament. In terms of insertion, it tends to insert also on three areas. It inserts at the iliotibial tract, at the lateral condyle of the tibia, and the gluteal tuberosity. The nerve that supplies the gluteus maximus is known as the inferior gluteal nerve, so IGN for short. And in terms of its action, the gluteus maximus muscle is present for the function of extension of the thigh, and it also assists in some form of lateral rotation. For the gluteus medius originates in between the posterior gluteal line and the anterior gluteal line, so it originates somewhere around this point. Somewhere around this point. It inserts at the lateral surface of the greater trochanter, so you can see a small chunk of the gluteus medius origin inserting at this point. So it inserts at the lateral surface of the greater trochanter, which is shown in the image here. The gluteus medius is innervated by a separate muscle. That muscle is known as the superior gluteal nerve. So it's innervated by a separate nerve, rather, superior gluteal nerve. And in terms of its function, it's present for it functions for the purpose of abduction of the thigh, so ABD, abduction of the thigh, and medial rotation of the thigh. So it abducts and medially rotates the thigh. Then the gluteus minimus muscle origin point tends to be between the anterior and inferior gluteal line. So if you notice, this is the anterior gluteal line here. Between the anterior and the inferior gluteal line, this is where the gluteus minimus muscle tends to originate, and that is depicted here by the muscle in yellow. It inserts at the anterior surface of the greater trochanter, so you can see both the gluteus minimus and gluteus medius insert at the greater trochanter. The gluteus medius insert at the lateral surface of the greater trochanter. The gluteus minimus insert at the anterior surface of the greater trochanter. So they're just inserting at different points on the greater trochanter. It is also innervated by the superior gluteal nerve. So both the gluteus medius and gluteus minimus are innervated by the same nerve, the superior gluteal nerve. And it also does the same function of abduction, abduction of the thigh, and medial rotation of the thigh. And finally, we have the tension fascia lata not shown in the image. Tension fascia lata tends to originate from the anterior superior iliac spine and the anterior part of the iliac crest. It inserts at the iliotibial tract and the lateral condyle of the tibia, and it is supplied also by the superior gluteal nerve. So all three um, of the muscles shown here, the gluteus medius, gluteus minimus, and tensor fasciae lata, are innervated by the same nerve. The exception to this rule is the gluteus maximus that is innervated by the inferior gluteal nerve. Let's drop down to the deep muscles or deep group of muscles in the gluteal region. These include muscles like the piriformis muscle, the superior gemellus muscle, the inferior gemellus muscle, the obturator internus muscle, and the quadratus femoris muscle, as shown in the image. You can see each of the muscles present here. So let's start with the piriformis muscle. The piriformis muscle tends to originate from the anterior surface of the sacrum, as shown here. You can see starting from the sacrum at this point, and it also has a bit of origination from the sacrotuberous ligament, although not shown here. But the sacrotuberous ligament tends to run from the sacrum to the iliac tuberosity. So both the anterior surface of the sacrum and the sacrotuberous ligament serves as origin points for the piriformis muscle. In terms of insertion, it inserts at the superior border of the greater trochanter. As you can see, this is the greater trochanter here. So just as we had the gluteus medius here and gluteus minimus here, or both of them inserting at the greater trochanter. Okay. The piriformis also insert at the greater trochanter, but it's inserting at the anterior surface of the greater trochanter. Sorry, the superior border of the greater trochanter, and compared to the other ones. In terms of the nerve supply, the piriformis muscle is supplied by a branch of anterior rami coming from S1 to S2. So the first and second sacral nerves innervate the piriformis muscle. And in terms of movement, it functions for the purpose of lateral rotation of the thigh, extension of the thigh, and abduction of the thigh. So it abducts the thigh ABD, it extends the thigh, and it laterally rotates the thigh at the hip joint. Then let's move on to superior gemellus muscle. Superior gemellus muscle tends to originate from the iliac spine. So this is iliac spine here. You can see the blue muscle shown here is serving as an origin point for the superior gemellus muscle. The superior gemellus muscle is the muscle in blue. So it originates from the iliac spine and then extends laterally towards the greater trochanter. It also inserts at the greater trochanter. The part of the greater trochanter that the superior gemellus muscle inserts as is the medial surface of the greater trochanter. You can see it inserts more medially at the greater trochanter. So it inserts at the medial surface of the greater trochanter and also at a point we call the trochanteric fossa. In terms of its nerve supply, the superior gemellus muscle is supplied by the nerve to the obturator internus muscle, which comes from L5 to S1. And in terms of movements or action, the superior gemellus muscle is present for the lateral rotation of the thigh, extension of the thigh, and abduction of the thigh, similarly to what we see for the piriformis muscle. So let's talk about the obturator internus, which is the next. Obturator internus originates from the pelvic surface of the obturator membrane, and that is shown here in green. You can see the obturator is the obturator foramen here. It's covered by an obturator membrane, and they have this muscle in green originating from the obturator membrane and extends all the way towards the greater trochanter. The obturator internus also tends to originate from the greater also tends to insert at the medial surface of the greater trochanter, just like the superior gemellus muscle. So both the superior gemellus muscle and the obturator internus insert on the medial surface of the greater trochanter, as well as the trochanteric fossa. In terms of nerve supply, it's supplied by the nerve to the obturator internus, which comes from L5 to S1. And in terms of movement, it does a similar movement to the superior gemellus muscle. It's involved in lateral rotation, extension of the thigh, and then abduction, abduction of the thigh. Then we have the inferior gemellus muscle, the fourth muscle under the D group of gluteal region muscles. This muscle originates from the iliac tuberosity. So unlike the superior gemellus that originate from the iliac spine, the inferior gemellus originate from the iliac tuberosity at this point. So this is iliac tuberosity present here. It also tends to insert on the same points at the medial surface of the greater trochanter as shown here. You can see all three muscles that I mentioned: superior gemellus muscle, the obturator internus, and the inferior gemellus muscle all insert at the medial surface of the greater trochanter. And the inferior gemellus muscle, unlike the superior gemellus muscle, is innervated by a separate nerve. So the nerve that innervates the superior gemellus muscle is known as the nerve to the quadratus femoris muscle. So the nerve to quadratus femoris muscle originates from L5S1, and it's also the same nerve that supplies the last muscle in this group, which is the quadratus femoris muscle. But before we get there, the inferior gemellus muscle, in terms of movement, is also involved in lateral rotation of the thigh, extension of the thigh, and abduction, abduction of the thigh. The last deep group muscle under the gluteal region muscles include is the quadratus femoris muscle. The quadratus femoris muscle should not be mistaken for the quadriceps femoris. That's a different muscle. Quadratus femoris is found in the thigh, and quadratus femoris is found at the hip. So quadratus femoris muscle originates from the lateral border of the iliac tuberosity. It's also going to originate from the iliac tuberosity. It's a muscle in yellow, so it originates from this point. It inserts at the quadratus tubercle of the intertrochanteric crest. So you can see that is just directly below the greater trochanter. It inserts at this point here. That is the quadrate tubercle on the intertrochanteric crest. And in terms of nerve supply, it has the same nerve supply as the inferior gemellus muscle, which is the nerve to the quadratus femoris, which comes from L5 down to S1. And then in terms of function, it's involved in the lateral rotation of the thigh. Let's move on to the muscles of the hip. The muscles of the hip tend to be grouped into three compartments because we have three compartments of the hip. This includes anterior compartment muscles, posterior compartment muscles, and medial compartment muscles. We'll talk about each of them one by one in the next couple of slides. Starting with the anterior compartment muscles, we have a total of four anterior compartment muscles. One of them is actually four in one. So in total, we have about seven anterior compartment muscles. So this includes the quadriceps femoris muscle. Quadriceps femoris muscle is a combination of four muscles that unites to form one. Each of these four muscles includes the rectus femoris, the vastus lateralis, the vastus medialis, and the vastus intermedius. Then we have the sartorius muscle, the pectineus muscle, which we talked about, and the iliopsoas. So we'll focus only on the sartorius and the quadriceps femoris because we already talked about the pectineus and iliopsoas muscle when talking about the muscles of the hip. Remember that these two muscles start from the hip or extend towards the thigh, and their function is largely at the thigh. The picture showing us the different muscles of the anterior compartment of the thigh. Starting with the rectus muscle, the rectus femoris muscle tends to originate from the anterior inferior iliac spine and a portion of the rim of the acetabulum. Here is the anterior superior iliac spine here. Just beneath that is the anterior inferior iliac spine, somewhere at this point, and that's the origin point of the rectus femoris. In terms of its insertion, it tends to combine together with the other three muscles of the quadriceps femoris, which includes the vastus medialis, vastus lateralis, and the vastus intermedius. And the combination of all four of those muscles gives rise to a single tendon known as the quadriceps tendon. And that tendon would insert at the patella. So the rectus femoris, alongside those three other muscles, insert at the patella. And then, in terms of the nerve supply comes from the femoral nerve, and the rectus femoris muscle functions for the purpose of flexion of the thigh and extension of the leg. So it flexes the thigh at the hip joint and extends the leg at the knee joint. For the vastus lateralis, which is the muscle in blue, originates from the intertrochanteric line. Uh, Also has a bit of origin from the greater trochanter, and then majority of its origin comes from the lateral lip of the linea aspera. So this particular muscle starts all the way up here at the top. Proximally, it originates from the intertrochanteric line and the greater trochanter, but the rest of the muscle on the femur tends to originate from a line or landmark on the femur known as the linea aspera. In terms of its insertion, it has the same insertion point or similar to the rectus femoris, which is at the patella through the quadriceps tendon. And in terms of its nerve supply, it's also supplied by the femoral nerve, and its function is in the function of extension of the leg at the knee joint. For vastus medialis also originates from the intertrochanteric line, but unlike the vastus medialis tends to originate um, from a large chunk on the medial lip of the linea aspera. So while vastus lateralis originates from the lateral lip of the linea aspera, vastus medialis originates from the medial lip of the linea aspera. It has a common insertion point similar to the rectus femoris and vastus lateralis. It inserts at the patella through the quadriceps tendon. It has similar innervations to the other two muscles mentioned, which is the femoral nerve, and it has similar functions to the vastus lateralis, which is in the function of extension of the leg at the knee joint. Then the last of the quadriceps femoris muscle is the vastus intermedius. It's not shown in the image here. The vastus intermedius originates from the anterior and lateral shaft of the femur. It's buried beneath the rectus femoris muscle. It has similar insertion points to the other three muscles of the quadriceps femoris, which is the patella through the quadriceps tendon. It also tends to be innervated by the femoral nerve, and it also performs the function of the extension of the leg at the knee joint. Then we move on to the sartorius muscle. Sartorius is the longest muscle in the body. It extends from the anterior superior iliac spine, as shown here, and runs all the way, crossing the entire thigh from lateral to medial, and eventually it inserts at the medial surface of the proximal tibia, which is at this point. Sartorius muscle is also innervated by the femoral nerve, and the movement it tends to partake in is the movement of flexion of the thigh and the leg. So it flexes the thigh at the hip joint and flexes the leg at the knee joint. It's also involved in the abduction of the thigh and lateral rotation of the thigh. So this is just an image showing for us the attachment of the quadriceps tendon to the patella. Remember that the quadriceps tendon tends to originate from a fusion of the tendons coming from the rectus femoris, the vastus medialis, the vastus lateralis, and the vastus intermedius muscle. And then this tendon inserts at the patella. From the patella, we have an extension of the tendon known as the patellar ligament, and that ligament comes from or moves from the tendon on attachment to the patella towards the tibial tuberosity. So we go from the quadriceps femoris tendon to the patella, and then from the patella tendon, from the patella all the way down to the tibial tuberosity at this point. It's also important to note that all compartments of the all anterior compartment muscles of the thigh are supplied by the femoral nerve, and that's just a unique feature about them that we tend to see. And this is also in contrast to the medial compartment muscles as well as the posterior compartment muscles that are supplied by similar nerves. I'll talk about that when we get to that aspect of the model. Let's talk about the posterior compartment muscles. There are three major posterior compartment muscles to note. This includes the biceps femoris muscle, the semitendinosus muscle, and the semimembranosus muscle. And they are all shown in the image below. You can see the biceps muscle in brown, semitendinosus in blue, and semimembranosus in yellow. So let's talk briefly about each of these muscles, starting with the biceps femoris muscle. The biceps femoris muscle, as the name implies, tends to have two heads. Hence the reason why we call it a bicep muscle in the first place. It has a long head and a short head. The long head of the biceps femoris muscle tends to originate from the iliac tuberosity. Whereas the short end of the biceps femoris muscle tends to originate from the linea aspera. You can see the long end originating higher up at this point at the ischium, and you can see the short end at this point originating lower down at the femur. So the short end originates from the linea aspera on the femur. Um, the long end, on the other hand, originates from the ischiac tuberosity. The short head also has some form of origination of the lateral supracondyle line of the femur. So aside originating from the linea aspera, it also originates from the lateral supracondyle line of the femur. The insertion of both of these muscles tend to be at the head of the fibula. So both the long head and the short head would fuse to form a single tendon, and that tendon would insert at the head of the fibula. The Both of these muscles tend to be innervated by a portion of the sciatic nerve. So the long head is innervated by the tibial division of the sciatic nerve. The short head is innervated by the common peroneal division of the sciatic nerve. So they are both innervated by the sciatic nerve, but they are innervated by separate branches of the sciatic nerve. In terms of their function, the biceps femoris muscle is involved in flexion of the leg at the knee joint and lateral rotation of the leg as well as extension of the thigh. So let's move on to semimembrane tendinosus. Semitendinosus muscle is the muscle shown in blue. It's the shortest or smallest of the three muscles. The semitendinosus muscle tends to originate from the same point where the long head of the biceps originates from, which is the ischiac tuberosity. You can see its origin point at this point, at this area. Same origin point to the biceps femoris muscle. It inserts at the medial surface of the proximal tibia. So you can see the semitendinosus also inserting at this point. So the same way in which the biceps tend to insert on the lateral part of the knee, the semitendinosus tend to insert on the medial part of the knee, but on a specific point known as the medial surface of the proximal tibia. Then, in terms of innervation, the semitendinosus is innervated by the sciatic nerve, but specifically by the tibial division of the sciatic nerve. For movement, the semitendinosus muscle tends to help in the extension of the thigh at the hip joint, flexion of the leg at the knee joint, and the medial rotation of the leg. The last muscle of the hamstring, the muscles of the posterior compartment of the thigh, is the semimembranosus muscle. You can see semimembranosus muscle in yellow. It sits directly beneath the tendinosus. So tendinosus is always on top of membranosus. Semitendinosus muscle tends to also originate from the ischiac tuberosity. It's not shown here, but it originates higher up. In fact, the reason why each of these muscles are grouped into one and known as the hamstring muscles is because of their single point of origination at the ischiac tuberosity. So all muscles of the hamstrings tend to originate from the same point, which is at the ischiac tuberosity, but they tend to be different in terms of their insertion. They tend to insert at different points. So the insertion point of the semimembranosus tends to be at the posterior part of the medial condyle of the tibia and also on the oblique popliteal ligament. So it inserts on a ligament, oblique popliteal ligament, and on a bone, the posterior part of the medial condyle of the tibia. The nerve supplied to the semimembranosus also comes from the tibial division of the sciatic nerve, and the function of the semimembranosus is the function of extension of the thigh at the hip joint, flexion of the leg at the knee joint, and the medial rotation of the leg. Let's talk quickly about the medial compartment thigh muscles. These are muscles that include the adductor muscles, including adductor magnus, adductor longus, and adductor brevis. And then we have two other muscles, the gracilis muscle and the obturator externus muscle. One thing to note about these muscles is that they are all innervated by obturator nerve. So just as we had the anterior compartment muscles innervated by the femoral nerve and the posterior compartment muscles innervated by the sciatic nerve, although different branches, we have the adductor muscles or the adductor compartment or medial compartment muscles rather being innervated by the obturator nerve. Let's talk about each of the different groups or muscles that gives rise to the medial compartment muscles of the thigh. Starting with the adductor magnus, which is the largest muscle of the group. It originates from 2 points. Usually, this tends to first of all be distinguished into two parts based on its origin point. So the adductor magnus has two portions to it. We have a part that we know as the adductor part of the adductor magnus, and we have a part known as the hamstring part of the adductor magnus. So the adductor part of the adductor magnus tends to originate from the inferior ramus of the pubis at this point. So it originates from the inferior ramus of the pubis. It also originates from the ramus of the ischium as well. So the ischiopubic ramus tends to be the origin point of the adductor part of the adductor magnus. The hamstring part of the adductor magnus, whereas, tends to originate from the ischiac tuberosity. Remember that all hamstring muscles, all of those three hamstring muscles mentioned, have a single origin point. The adductor magnus also has a similar origin point to the entire hamstring muscles, which is the ischiac tuberosity. And that part of the adductor magnus that originates from the ischiac tuberosity is known as the adductor part of the adductor magnus. In terms of its insertion point, it inserts at the at different points as well, depending on what part of the muscle we are talking about. The adductor part of the adductor magnus inserts at the gluteal tuberosity, as well as the linea aspera, whereas the hamstring part tends to insert at the adductor tubercle of the femur, somewhere around this point. So it inserts at the adductor tubercle of the femur. So this part that is you are seeing here at the adductor tubercle is the hamstring portion, and this part that you are seeing here tends to be the adductor part. The adductor part inserts at the linea aspera, the gluteal tuberosity of the femur. Innervation of the adductor magnus comes from two different nerves, depending on the part we're talking about. The adductor part of the adductor magnus is innervated by the obturator nerve, just like every other muscle in the medial compartment of the thigh. Whereas the hamstring part, you could always guess the hamstring part will be innervated by the tibial part of the sciatic nerve because it's similar to the hamstring muscles based on its origin point. The movement of the adductor magnus is in the movement of adduction of the thigh, flexion of the thigh. So it adducts and flexes the thigh. Usually the adductor part adducts and flexes the thigh. The hamstring part, whereas, tends to extend the thigh at the hip joint. The other muscles in the group of adductors includes the adductor longus and adductor brevis. Let's start with the adductor longus. Adductor longus is shown in the image here, it's the muscle in yellow. Adductor longus tend to originate from the body of the pubic ramus as inferior to the pubic crest. You can see the muscle origin point at this point is the pubic crest at this point. You can see it's just originating just inferior to the pubic crest in the body of the pubis. In terms of insertion, it inserts at the middle third of the linea aspera. So this is the entire femur. You can see that the middle third of the femur, where the linea aspera is the insertion point of that adductor longus muscle. In terms of its innervation, it's innervated by the obturator nerve, just like every other muscle in the medial compartment of the thigh. And in terms of function, it tends to perform the movement of adduction, adduction, ADD of the thigh at the hip joint. The adductor brevis just lies directly above the adductor longus, as shown here as the muscle in green. It has its origin point from the body of the pubis and the inferior muscle of the pubis, also shown here. It inserts at the pectineal line at the upper part of the linea aspera. You can see its insertion point more proximal to the adductor longus. The innervation of the adductor brevis also comes from the obturator nerve, and its movement is in a function of adduction of the thigh at the hip joint. Then finally, we have the gracilis muscle and the obturator externus muscle rather. The gracilis muscle tends to originate from the body of the pubis and the inferior ramus of the pubis, just shown in the image. It is not shown in the image rather. However, you can see cut of the gracilis muscle in this image here. This is the cut of the gracilis muscle shown here. So the gracilis muscle tends to insert at the medial surface of the proximal tibia. It is innervated by the obturator nerve as well, and the function of the gracilis muscle tends to be the function of the movement of adduction of the thigh at the hip joint, flexion of the leg at the knee joint, and then it helps in medial rotation of the leg. The last muscle under the medial compartment group includes the obturator externus muscle. This muscle originates from the margin of the obturator foramen and the obturator membrane, just like the obturator internus muscle. So it originates from the margins of the obturator foramen and on the obturator membrane. It tends to insert higher up at the trochanteric fossa of the femur, somewhere around this point. And its innervation also comes from the obturator nerve. Its function is the function of adduction of the thigh at the hip joint. Let's move on to muscles of the leg. The muscles of the leg, just like the muscles of the thigh, are also grouped into three major compartments. This includes the anterior compartment muscles, the posterior compartment muscles, and the lateral compartment muscles. The anterior compartment muscles of the leg are four in number. This includes the tibialis anterior muscle in green, the extensor digitorum longus, the extensor hallucis longus, and the fibularis tertius muscle. Each of these have different origin points and insertion points and perform different functions on the leg. The most important thing to note about these muscles is that they are all supplied by similar nerves. They all have innervations by the deep fibular nerve. So the deep fibular nerve supplies the anterior compartment muscles. Just a bit of differences in terms of their origin and insertion as well as movement. Tibialis anterior tends to originate from the lateral tibial condyle, as shown here. Insertion of the tibialis anterior tends to be on the inferior surface of the first cuneiform bone and then the base of the first metatarsal. Not so important to really know. And then the movement of the tibialis anterior, which I think is extremely important, is in the movement of dorsiflexion of the foot. So it helps in dorsiflexing the foot and inverting the foot. So it inverts. Inversion is a movement inward, is an inward movement towards the midline. Dorsiflexion is an upward movement of the foot, like you are standing on your heel. So in terms of the extensor digitorum longus, its origin tends to be also on the lateral tibial condyle, as well as the anterior surface of the tibia and the interosseous membrane. It inserts at the extensor expansion or dorsum of the lateral foretoes, and it performs the function of extension of the toes and dorsiflexion of the foot. So it helps in also dorsiflexing the foot aside extending the toes. The extensor hallucis longus muscle, is a muscle that tends to supply the big toe. It's originating from the middle one third of the anterior surface of the fibula, as well as the interosseous membrane. It inserts at the base of the distal phalanx of the hallucis. So the base of the distal phalanx of the first toe. It performs the function of extension of the first toe or the hallux. Remember that the hallux means the first toe. So when we talk about anything that has to do with hallucis or hallux, we mean the big toe or the first toe. So it extends the first toe, and it also helps in dorsiflexing the foot. The final muscle in this group is the fibularis tertius muscle. The fibularis tertius muscle tends to originate from the distal anterior surface of the fibula. It inserts at the dorsum of the shaft of the fifth metatarsal. It is involved in a muscle in the function of dorsiflexion of the foot and eversion of the foot. So eversion is an outward movement away from the midline. Like this, you are inverting by moving away from the midline. Yeah, so this is an inversion movement. Let's talk about the lateral compartment muscles. This includes the fibularis longus and fibularis brevis muscle. The unique thing about these muscles is that they are both innervated by a similar nerve. They are innervated by a superficial fibular nerve. So the anterior compartment muscle is innervated by the anterior fibular nerve, whereas the lateral compartment muscles rather are innervated by the superficial fibular nerve. Aside this similarity in terms of innervation, they also have similarities in terms of movement. Both of these muscles are involved in evasion of the foot and plantar flexion of the foot. So they are both involved in evasion. Evasion is a displaced movement away from the midline, and plantar flexion is movement of the foot, downward movement of the foot, whereby we are standing on our toes rather than our heel. In terms of the differences between the fibularis longus and brevis, they tend to be different in terms of their origin point and insertion points. Fibularis longus tends to originate from the head of the fibula at the upper two-thirds of the lateral surface of the fibula, and then inserts at the inferior surface of the first cuneiform bone and then the base of the first metatarsal. Whereas the fibularis brevis originates rather at the lower two-thirds of the lateral surface of the fibula and insert at the tuberosity of the fifth metatarsal. So these are just pictures showing for us the muscles or of the anterior compartment as well as the lateral compartment. You can see each of those muscles tending to be wrapped around by some retinaculum as they cross from the leg to the toe. So you can see the extensor muscles on the anterior compartment of the leg. You can see the tibialis anterior and then the extensor digitorum longus and extensor hallucis longus. They are surrounded by a unique retinaculum as they cross the leg towards the toes, towards the feet. And then finally, on the lateral side, you can see the two lateral muscles, the fibularis brevis and fibularis longus, and you see how they tend to insert at different points. One of them is inserting at the base of the feet metatarsal, the other is inserting at the coniaphone bone. Let's finish up with the posterior compartment muscles of the leg. This tends to be divided into two subgroups, including the superficial group and the deep group. We'll talk about each of them one by one in the next couple of slides. The three major muscles that form the superficial group of the posterior compartment muscles of the leg. This includes the gastrocnemius muscle, the soleus muscle, and the plantaris muscle. The gastrocnemius and the soleus muscle are very unique muscles that form a large bulk of the muscle tissue of the back of the leg. Gastrocnemius tends to originate from the medial. It has two portions of origin, two heads to it. So it has a medial and lateral head. The medial head tends to originate from the medial condyle of the femur. The lateral head originates from the lateral condyle of the femur. You can see their origin points at this um, area outlined. They both insert together with the soleus muscle. The soleus and the gastrocnemius combine together to form a single tendon known as the calcaneal tendon, and that tendon inserts on the calcaneus bone. The innervation of the gastrocnemius comes from the tibial nerve. Tibial nerve is a branch of the sciatic nerve. Sciatic nerve usually tends to split into tibia and common peroneal. The common peroneal nerve will split into the superficial and deep fibular nerve. Superficial fibular nerve supplies the lateral compartments. The deep fibular nerve supplies the anterior compartments, whereas the tibial branch of the sciatic nerve supplies the posterior compartments, as shown here. The gastrocnemius muscle is involved in flexion of the leg and plantar flexion of the foot. Soleus muscle is the next muscle under the superficial group. Soleus muscle tends to originate from the head of the fibula, and there's a particular point or landmark on the tibia known as the soleal line or soleus line. The soleus line also serves as a point of origination from the soleus muscle. And then the last aspect of origin point of the soleus muscle is the medial aspect of the proximal tibia. So it has three origination points. One is on the fibula, two are on the tibia. The one on the fibula is the head of the fibula. The two on the tibia is the soleus line and the medial aspect of the proximal tibia. In terms of its insertion, it inserts together with together with the gastrocnemius muscle, forming the calcaneus tendon and inserting on the calcaneus. It is innervated by the tibial nerve, and it is involved in the function of plantar flexion of the foot. The last muscle in this group is the plantaris muscle. Plantaris muscle is a unique muscle in terms of its function and its structure. In terms of its structure, it tends to originate from the first of all originate from the lower aspect of the supracondylar line, and then it runs down obliquely from that lateral point to the medial part, wrapping around the soleus muscle as it descends. And if you notice, the plantaris muscle tends to thin out, or tends to thin out as it runs down, as it descends towards the distal part of the leg. So the point in which the entire muscle starts to look more like a nerve rather than looking like an actual bulking muscle. So the tendinous part of the muscle tends to be what thins out as it descends. And usually we tend to mistake the plantaris muscle or the plantaris tendon for a nerve, and as a result, that's usually one of the big mistakes, quote unquote, of freshers when they are involved in a steeplechase scenario where the plantaris muscle is being displaced and they are asked to identify it. The insertion point of the plantaris tendon tends to be on the posterior aspect of the calcaneus. The plantaris muscle is innervated by the tibial nerve, and it is involved in the function of flexion of the leg and plantar flexion of the toes, or rather plantar flexion of the foot. Let's move on to the deep muscles of the leg. This includes the gluteus muscle, the flexor digitorum longus, flexor hallucis longus, and the tibialis posterior muscle. All of these muscles are also innervated by the tibial nerve. In terms of their differences, the gluteus muscle originates from the lateral condyle of the femur. You can see it originating higher up compared to the other muscles of this group. In terms of insertion, it inserts at the posterior tibia above the soleus line, so it's not really going to run all the way down. It tends to have very short course from the femur down to the tibia. It is innervated by the tibial nerve, as said, and in terms of its function, it has a very unique function of medial rotation of the leg. In fact, the popliteus muscle is said to be the muscle involved in the function of locking and unlocking of the knee joint. It also helps in flexing the leg at the knee joint. The flexor digitorum longus muscle is the next muscle in the group. It originates from the posterior aspect of the tibial distal to the soleus line, so it's just below the soleus line. This is the soleus line in this image. The soleus line above it is the popliteus muscle, below it is the other three muscles. So the flexor digitorum longus just innervates below the soleus line on the posterior aspect of the tibial. It inserts all the way down to the foot. It inserts at the base of the distal phalanx of the lateral foretoes, and it is involved in the movement of flexion of the toes and plantar flexion of the foot, as well as inversion of the foot. So it helps in inverting the foot, plantar flexing the foot, and flexing the foot. Then we have the flexor hallucis longus. This is a muscle that originates from the distal to third of the posterior tibia, as shown here. It is going to also insert at the base of the distal phalanx, particularly on the hallucis, that's the great toe. So just as we had the extensor hallucis longus inserting at the hallucis or the great toe, we also have the flexor hallucis longus inserting at the base of the distal phalanx of the great toe. It is involved in the movement of flexion of the great toe, as the name implies. So it flexes the distal phalanx of the great toe, but it also assists in plantar flexion and inversion of the foot. The last muscle in this group is the tibialis posterior muscle. This is a muscle that tends to originate from the posterior surface of the tibia just below the soleus line, as shown here. That's the muscle in brown. It also has a form of origination from the posterior surface of the fibula and from the interosseous membrane. It inserts all the way down at the tuberosity of the navicular, also on the cuboid bone, the cuneiform bone, and the sustentacular thalli of the calcaneus bone. And then it also inserts at the base of the metatarsal from the second to the fourth metatarsal. So it inserts at different points of the foot. It is involved in the movement of plantar flexion of the foot and adduction of the foot. So if you pay attention, you will notice some similarities of the muscles of the compartment of the leg. This includes the fact that the different compartments of the legs are innervated by different muscles, by different nerves, and the different compartments of the leg are involved in different forms of movement on the feet. So the posterior compartment is innervated by the tibial nerve. The anterior compartment is innervated by the deep fibular nerve, and then the lateral compartment is innervated by the superficial fibular nerve. And in terms of function, remember that the deep, the anterior compartment muscles tend to be involved in dorsiflexion, whereas the posterior compartment muscles tend to be involved in plantar flexion. That's one unique difference between them. Let's round up by talking about the muscles of the foot. The muscles of the foot are usually divided into two major compartments. This includes the dorsal compartment muscles and the plantar compartment muscles. We have two major muscles in the dorsal compartment. This includes the extensor digitorum brevis and the extensor hallucis brevis. Both of these muscles tend to be involved in extending the hallucis and the other four toes, and both of them are supplied by the deep fibular nerve. In the plantar compartment of the foot, we have that particular compartment being subdivided into four layers of muscles. We have the first layer, second, third, and fourth layers having different forms of muscles that tend to span them and take in different functions. The first layer of the plantar compartment muscles of the foot includes three major groups of muscles. These are the adductor hallucis muscle here in yellow, the flexor digitorum brevis muscle in brown, and the adductor digiti minimi in blue. Each of these muscles are supplied by a similar nerve. They're supplied by the medial plantar nerve. The second layer of the plantar compartment of the foot, we have two major muscles found there. This includes the quadratus plantae muscle and the lumbrical muscles. The quadratus plantae muscle is shown in blue, whereas the lumbrical muscles are shown in yellow. They are supplied by different nerves. The lateral plantar nerve supplies both the quadriceps plantae muscle and the second to fourth lumbrical muscle. So from the second all the way down to the fourth muscles alongside the quadriceps plantae muscle are supplied by the lateral plantar nerve. The first lumbrical nerve, whereas the first lumbrical muscle, whereas is supplied by the medial plantar nerve. The third layer contains three major muscles. These are the flexor hallucis brevis, the adductor hallucis, and the flexor digiti minimi, all shown in the image here. The flexor hallucis brevis is supplied by the medial plantar nerve, whereas the adductor hallucis and the flexor digiti minimi brevis are both supplied by the lateral plantar nerve. The last layer of the plantar compartment of the foot includes the fourth layer, and this is going to be spanned by two major muscles, the plantar interosseous muscle and the dorsal interosseous muscle. The plantar interosseous muscle tends to be involved in adduction of the toes, adduction, whereas the dorsal interosseous muscle is involved in abduction, abduction of the toe. Both of these muscles are supplied by the same nerve, the lateral plantar nerve. Let's end this particular module by talking about a common test to the um, gluteal muscles that we mentioned and the nerve supply. This is known as the Trendelenburg test. This Trendelenburg test tends to be done to access the integrity of the gluteus medius and minimus. Whenever we have a damage of the gluteus medius or minimus, or a damage to the nerve supply to the gluteus medius or minimus, which is the superior gluteal nerve, we could have a form of gait known as the Trendelenburg gait. And I'll show you pictures of how this looks like in the next slide. But practically what happens is that we ask the individual to stand on one part of the foot, one part of the lower limb, and what we tend to see is that the one side of the lower limb would slant, um, whereas the other side remains up. That slanting is known as the Trendelenburg gait. So in this particular image, we would notice that the individual is standing on one foot, and on the one side, you see that there's an equal balance between on the pelvic region, and this is the normal expected um, um, posture of an individual with an intact gluteus medius and minimus or an intact superior gluteal nerve. On the other side is an example of a Trendelenburg gait. So this is the Trendelenburg gait present here. The individual is standing on one side, the right side, where you can see that the pelvic region is slanting more to the left. So whenever we have an abnormal slanting of the hip on one side, usually with the opposite side is what area that is affected. So in this area, in this image, um, although the um, although the pelvis is slanting to the left side, what that shows is that there's a right superior gluteal nerve damage, or there's a right gluteus medius and minimus damage as a result. So always remember that on the Trendelenburg gait, the side where the hip is slanting to is the normal side. The side that is appearing normal is actually the side that is defective. The reason for this is because the muscles on this side are active compared to the muscles on this side. So the muscles on this side will drag the entire pelvis downward because they are contracting unopposed compared to the right side in which there's a damage. And that concludes our module on the muscles of the lower limb.